right, we're back with Dr. Chouksey, who is with ACMC. How you doing, Doc?
Good, very good. How are you?
Good, good. I'm glad you came in today because it's pretty timely with the change of the seasons and all that sort of stuff.
Sure.
Yesterday we had temperatures in the 80s. Now it's down to 50 or something this morning. But I have noticed the watering eyes and the runny nose, and
Sure.
isn't it a little early for that though? Because the pollen's not really out there, is it?
No, actually, there was a report from Ohio Department of Health around 2 weeks back that the number of visits in the emergency room have gone up, and the tree pollen has started to show up.
Really?
So the pollen will show before the leaves come. So,
Okay.
so tree pollen pollinates early, and it was directly correlated to the high pollen count and increase in the upper and lower airway symptoms.
Really?
So yeah, plus this roller coaster of the weather, up and down, it kind of messes up your AC system of the body, if you will, your nose and sinuses and the lining.
Mm-hmm.
So a lot of people been having problem over last 2-3 weeks. It's actually worse than having a continuous string of one constant weather. So if weather stays up in constant, that is less of a fluctuation, and body tends to adjust to it much more steady way as opposed to up and down, what is kind of happening here and typically happens here.
I was talking to a friend of mine yesterday on the phone, and he says, I've missed some work. And I go, what's the matter? He goes, it's not a cold. It's something to do with my allergies, where he's got drainage and coughing, and he said, I got to the point where I actually had to go to the doctor to see if he could do anything. Is there anything you can do about that?
I think the regular maintenance of it, and the problem is that you got 4 pair of sinuses on each side, okay, and they all drain inside your nose. And the drainage is the very small ostia or openings, which is on the lateral side of the nose or the cheek side of the nose. Mm-hmm. So if you have anything clogging the lines up, then mucus, which is secreted, and that's the job of the lining of all the sinus in this, that you secrete mucus, so all the things keeps going down, and whatever you breathe in, if there is dust particles or pollens or any harmful things, the body flushes it out with that.
Okay.
So what happens is that if those openings or ostia are not draining well, because they are swollen up, because you're looking at very small openings inside all these sinuses. So a little bit swelling will clog them up. And this is the problem. Humans are lazy by nature. If you're not forced to do anything, you won't do anything. Mm-hmm. So people don't jump on the problem till it happens. Mm-hmm. And once it happens, they try to do all the kind of thing to circumvent it. But they don't go to the root cause of it. So your folks, or every day, like yesterday we had one patient, 2 actually patients came with urgent add-on because one had skin problem, one had sinus, and the airway problem. So if you don't maintain them well, it's very easy to get in trouble because the openings you're dealing with are quite small. So if there's overall these problems, then I think you really need to work ahead, prepare ahead, and just be doing fine-tuning all the time. Otherwise you'll get in trouble.
Is that why, because of these areas that you say are on both sides of the nose, is that why your cheeks get sore?
Yeah, there's a cheek sinus called maxillary sinus. There's sinus around eye, between eye and the nose, called ethmoid sinus.
Yeah, I know what you're talking about.
And there's frontal sinus right here. Okay. And there's a sinus behind the eyes, both the eyes, called sphenoid sinus. So these 4 sinuses are there.
Wow, I didn't know that.
Yeah, so based on that, that's why a lot of people have headaches. Some people have here, some people get here, some people just feel here, and some people get pain behind the eye, which could come from that or discomfort. Mm-hmm. And overall you get the sensation of fullness. Also what happens is you need to see that this is the main sewer system or gutter of the sinus and nose and ear. The ears drain behind the nose, the sinuses drain inside the nose, and all the ingress of everything you're exposed to, pollens, dust, temperature, all things come ingress through the nose. So it's the body's drainage and it is the body's filter through the nose. And the nose passage is small, and many people have coexisting problem with the drywall or the partitioning of the nose, if you will. You know, the thing which props our nose up is a septum, okay, which is cartilage. And many times it could be one side or other. So then if you have a little bit deviation, which majority of people will have a little left, little right, so one side is a little narrow than other, so then you really get hit pretty hard with that. So it's a very common problem, and I think sinusitis is likely over-treated because people don't know that what's going on, and the symptoms are so much overlapping into it. So a lot of these problems are here.
I noticed last night, we had beautiful weather yesterday, and it dropped really, really quick. It started raining. So I'm on my sun porch, and it never fails out there in that sun porch at night. I need to blow my nose, wipe my eyes out, and there's nothing really there, but it's just like I'm blocked up. So there's got to be something out there that I'm allergic to.
Yeah, you know, I think what you're feeling is very common, a sensation of congestion inside the nose. And the congestion, people equate anything blockage to something coming out. Okay?
Right.
In other words, people feel, okay, my nose is congested, so there has to be some kind of crust or some kind of obstruction physically there, which is movable. But that is not the case. What happens is that if you have chronic, say if you're exposed to some allergens, be it inside your house, like you're saying, dust or carpet or animals, okay, or mold, or be it outside the house, which could be dirt, it could be pollens, it could be the grass and everything, plus there are a lot more mold outside too. Whatever it is, if you're continually exposed to it, the body, if body doesn't like it, then body's response or response of your sinus and nose is to flush it out. And the way you flush it out is by making more mucus. There are glands which make mucus, which line the whole airway for you, which starts from nose, sinus to the lung. So those lining get muscular, if you will. Okay, it's like working out with dumbbells. You do crunches, you do this, then your biceps get bigger because you're working them up. If allergens or irritants for that fact, smoke, okay, ozone, strong odors, perfumes, all these things, if they don't like, the body has only one way to do it. It just makes more mucus, the lining get much more bulked up, and in doing so, they become swollen. And because they're becoming swollen in a finite space, you have narrowness inherent with it. So a lot of people feel, well, it is narrow because there's swelling of the lining, which is causing it. So you can blow, and you know you can only blow so much mucus out what is there. If it is there, which is blocked up in the sinuses and the other thing, you cannot get it out because the filter line, because the drainage pipe is not there, or the lining could be simply just swollen up. So it's a chronic problem.
A question that was emailed earlier. Besides medications and that sort of stuff, is there such a thing as surgery and any of this sort of stuff that would?
Sure. It depends what the problem is. So if the problem is anatomic, or problem is that your openings or osteas are very, very narrow by default, then nothing you can do can change it. If problem is your bone is too much to one side, medications is not going to push it back. So you have to look at both. And as a matter of fact, we are looking at ACMC of starting a sinus allergy center with me and ENT docs there to approach both together. So you know, in time to come, likely it will happen at some time. We're beginning to talk about it. So I think there are two components of it, but surgery is a more interventional measure, and you know it can cause patient has to be selected carefully. It can cause scarring and problems there, and no surgery is this thing. So first, the medical mantra is to try identify your triggers, which we can do very simply by with patients visit coming to office. They will know before they leave what they're allergic to. Then we can train them as to say what they can do. Medically you manage first, and if you cannot fix it, then there are patients certainly who need combination of both of those things.
Okay. Okay.
So I hate medications, Actually, all doctors, I would say, dislike medicine because we are forced to give medicine because people have problems. So there are few common things I tell patients, okay? And this is what we train them, and I think I'll tell some here for the listeners here. That the one thing I find, if you have chronic problem with your nose or sinus all the time, I very often, and I see a lot of patients with chronic sinusitis and immune problem and allergy together, and what I tell them to do is to keep this area pristine and clean. And the simplest non-medical way of doing that, in my opinion, is to devote 15 minutes every day. And what you do in that 15 minutes every day, usually is at night time, before you go to sleep, after you take a shower, you take a pot of water, old fashioned, boil it and cover it with a lid. So let it have a lot of steam. And there's no need to put Vicks and this and that and all effervescents in. Okay, so you can put that in, let it simmer and make a lot of steam. Then you put on the table in a safe manner and you cover your head with a towel and just take the lid off and sniff through the nose only, not through the mouth. Steam is warm, is hot, it ascends, and it can penetrate any nooks and corners within your nose. When you do that, you liquefy all the mucus in your sinuses, you'll drain it out. It's better for your skin of the face, it's better for the hair growth, and it's better for your nose and sinus. But you need to do 5, 10, 15 minutes.
That is an old-fashioned method that my mother...
Old is gold, it doesn't mean that, technology is good because we can zoom down to genetic level and do that kind of thing. But doesn't mean that what simple fixes are really worth it. I every day, couple of patients I'll tell this.
Really?
Yep. And they will do good, but the problem is nobody has time and patience. They want a pill to fix everything or a shot to fix everything.
Right.
Okay. So with people who do it, they really get better. And I have a lot of patients who will swear it by.
And I don't even know if they have these things anymore, but I remember when we were little and we got colds, they used vaporizers.
Yeah, they are vaporizer, and one thing I don't like about vaporizer is that you put thing in the nose and a gust comes too quickly. And what happens if you force something too quickly, it actually causes irritation and annoyance in the process. So I am against the things which, they have all kind of these things, container, you put it in and boom, it comes in, because you are ramming steam through the nose too quickly, and that is not most friendly way of doing it. I think this method I'm saying is free and it is much more body friendly.
I never liked the vaporizer myself, but I could understand probably what you just said.
Right.
Would make more sense in a way.
I think I also wanted to touch base on two main issues as it relates to allergies. Nose, sinus, a lot of people can have asthma this time of the year. If you've seasonal asthma in spring, summer and fall, it could be because of the tree pollens, it could be because of the grasses, weeds, and then towards the fall decomposing of the leaves. And it's very common, and millions of people throughout the country and worldwide experience this. So there are two things. One is to identify what you're allergic to, which they can go to any certified allergist and they will be able to find out and tell them. And then you need to work on avoidance of that thing, whatever it is, inside or outside. And the only thing you can control is inside. Pollen allergy is quite common. And unfortunately, good prices come with a price. So good landscapes will bring a lot of pollen exposure to it. And you cannot change that. I cannot go and take your grass out or everybody's trees out.
Right.
So if there are outdoor allergies, then I think, and most people have indoor and outdoor combined, then you take the medications to mend the symptoms, but you don't cure the disease. So a problem is chronic, recurring a lot of times. Allergy immunotherapy is a potent, very effective way of curing that problem. So you can identify, first of all, I would suggest simple test, come to the office, know what you're allergic to, and try to work with it. And very simple medications if you can keep up with it, okay? Second thing is, if you're really tired, you have lung involved, you have chronic sinus problem, couple of courses of antibiotics, skin rashes coming, this all can happen because of contact. then we can put patients on appropriate allergy immunotherapy or allergy shot. And over course of 12 to 18 months, their body will respond and they will get 80, 70, 80, 90% in that ballpark relief. But that relief is actually going to be permanent and long term for the duration of injection. So that is way of putting your immune system kind of to back off, and you don't need the medications for it. So these are the two modalities, very good, and it's a common problem, far-reaching. And number one prescription for antibiotic in this country in adults is for sinusitis. And at least 50, 60, 70% of that sinusitis is comorbid or coexistent with the allergic inflammation in nose and sinus. So I think it's worth a visit and it's worth a shot, so to say, for those patients to get over it.
You know, 40 years ago, my home doctor, my doctor, I was complaining about this particular problem even back then. And he said, if you want to get that corrected, move to Arizona. That's basically what he was saying. He goes, because this climate here, next to the lake, you're going to have that. Most people have that problem.
Yeah, lake does bring more mold into the atmosphere. It depends where you go, okay? So if you go to Arizona, that is true, vegetation will be less, okay? Mm-hmm. You go to Colorado, I had a patient last week. They just went to Colorado, came back, and they had a lot of issues with it. So what happens if you go to Colorado up in the mountains,
right,
very high altitudes, will have lower levels of dust mites. Okay, so dust mite allergy could be better in very high altitudes. But the higher the altitude, the thinner the air. Mm-hmm, okay, mm-hmm. So people with lungs problem and thing, they actually get problem at high altitude because the denseness of the oxygen reduces as you go up and up, so the breathing problem can get up. Mm-hmm. So there's some credit to that, what they're saying.
Yeah.
But it doesn't mean that the people in Texas won't have allergies, because again, down south the weather is very hot, plus spring and summer are much longer. So whatever is blooming there blooms for a little longer time. So there's no easy win or fix for it.
Yeah.
We can wish and and debate, but I don't think there's any such a simple solution that you move left, right, or up and down.
Didn't you tell me the last time you were on here a few weeks ago that when somebody comes to you, when they walk out of that office, they're going to know what's wrong with them? Mm-hmm. That's your philosophy.
That's true.
Yeah, I think that's interesting.
Yeah.
So it's just an easy an easy test to see what you're allergic to.
It's very easy test. It's called immediate test because the results are available within 30 to 45 minutes. I have very dedicated staff, Kayla and Kristen. They've worked very hard with me and they've done a very good job with the patients. So we can do the testing, we can tell them within an hour what they're allergic to, and then we can come out with a custom-made plan for them. And I think most patients will benefit from it.
And I thought that was amazing because I was thinking it was like a 6-week process, so you wouldn't know anything.
No.
But it's that quick.
It is quick. We try to do things quickly, and it's immediate testing. It's called immediate hypersensitivity. So that could be done. And pet allergies, as you know, people have all kind of pets. I see people with snakes. I had a patient with raccoons as a pet. I had a patient with, you name it, 5, 6, 7, 8 cats. You got, of course, horses around here.
Yeah.
You got rabbits here. It's very good. From that perspective, it's good. But there are a lot of allergens and animal dander, and people want to believe, okay, my dog is less allergic than the other, or my cat is not problem, but somebody else's cat is problem. But that is not the case. The basic protein which causes problem for all these animal dander is the same, and only amount which varies is the dander, they shed more or less. Right. But it doesn't matter. I mean, they have protein in their sweat and their urine and their saliva and everything. So I would urge patients or listeners not to buy hypoallergenic dogs and cats and dole out large amount of money. They won't go too far. I mean, the problem is not going to go away with that.
My mother is very allergic to cats, and if she gets around one or even touches one, her eyes balloon up, or they get like something, kind of like I don't know what you call it.
Conjunctivitis and things. Yeah, cat allergy is very effectively curative. You can cure that allergy very well.
You can.
Yep, the allergy injection works very well for cats. Okay, so we have patients every day in office with allergies to cat, and a lot of patients in injection. Typically people get 2 vials of injections. One will be the pollens, trees, grasses, weeds, and other will be animals, dust mite, and mold. Okay, so they stay put. So I usually give 2 vials, and some people are so allergic. I have a handful of them getting 3 vials because I cannot put everything into it. So we do the testing. When you come on first visit, we try to do everything. Most people have breathing problems, sinus problem, allergy problem, and skin problem. What I see, sometimes it takes more than a visit to do all the testing for them. So we do that, and after that, we try on the medical management first, and if that doesn't work, then we suggest to give allergen immunotherapy or allergy shots. Most of the people will get 2 injections, and one will be pollen, as I was saying, other one will give the mold and animal dander in it, and then they go on this regimen of getting shot, come to the office 1 to 2 times per week, and within 6 to 9 months they will get what we call maintenance concentration. And after that, your visits go less and less, once every week for 3 months, then once every 2 weeks for 3 months, then once every 3 weeks for 3 months, and by time of 18 months they are into treatment, they'll be getting 1 shot or 1 injection every month or 2 injection every month.
Okay.
And
You mentioned snake.
I have people do.
But you wouldn't get an allergy from a snake.
No, the problem is that nobody has studied that, but when you have snakes, you feed them rat and mouse.
Right.
Okay,
Yeah.
and that is a common allergen. As a matter of fact, one of the panels we have for testing has mouse, rabbit, rat, everything in it. Labs, people working in labs.
Yeah.
Here, not too many. In city, I have a huge problem. Big universities, you're experimenting with rats day in and day out, and people have significant problem in mouse and rat.
Really?
Yeah. So you have, people have live mouse and live rat. They feed the snake, so they keep it and then they feed it. Or
Never thought of that.
yeah, and right. So that's right. I mean, in a snake, for allergy perspective, it's not studied thus far, fortunately.
Yeah.
But rats are used to feed them.
Yeah, that's true.
Yeah. So I think treatment is good, effective. We are here, and I have a clinic running well into the evening. Actually, last night, Mondays I'm here from 8 a.m. to 8 p.m. So people can come after work, kids can come after school. I've actually expanded the need of the clinic based on the patient's demand and request from here.
Are you in the building across from the hospital?
I'm right in the hospital.
You're right in
I'm right in the ACMC medical office building, right next to emergency room.
So, what are your days? You're in.
I'm here all day Mondays. I'm here all day Thursdays and Tuesdays. For last 3 weeks, I've opened a clinic every 2 to 3 times a week. On Tuesday morning, I go to Jefferson.
Oh.
And to start serving that part of the county.
Really?
So I'm going there, and then so I'm here Mondays, Tuesdays, and Thursdays. Very long Monday, regular Thursday, and morning of Tuesdays.
What about Friday? The Fridays?
No, Friday. No, these are the days I come here.
Okay. And
so
then you're based out of where then? Are you work towards the clinic or?
No, this is my commitment here to ACMC.
That's
Other days I'm not, but I may end up opening some other offices in other
Really?
areas. Right.
Wow. I'll tell you what, you're much needed here because.
Yeah, no, and that's why I came here. I think people have been traveling outside ACMC or outside Ashtabula County to seek these treatments. I have patients coming from Pennsylvania.
Really?
Yeah, I mean Erie is not that far.
No.
Okay, so I actually saw one patient yesterday. They came from, I forget the name of the town, somewhere in Pennsylvania. People coming from Andover. I have a lot of people now coming from Geneva. People coming from Madison. I have a couple of patients from Mentor. So I really envision 30-40 mile radius around here. We should be able to provide all the services they need.
Mm-hmm. Excellent.
Yeah.
I understand you're going to be a guest of the Rotary Club today.
Right. I think at noontime I'm scheduled to meet with them.
It's at noon at the public library here.
Yep.
Matter of fact, that was Kathy. That's
right. I saw her over there.
Yeah.
Excited and interested.
She said it was going to be a very good meeting today, and she said she was looking forward to it.
Sure.
So
No, that's wonderful. I'm looking forward to meet with them.
she was hoping that you would talk about allergies and
Sure.
immunization shots and all
Right,
that sort
right.
of stuff.
Absolutely.
Yeah.
Yeah. And I also wanted to get to the involved with the schools around here
Uh-huh.
because a lot of athletes and school athletes have asthma, and a lot of kids in school have food allergy. We don't have time to discuss that today.
We can do that next time.
But food allergy and everything is very common. So over time, I hope that it'll be a very worthwhile service for the whole community around here.
Absolutely.
The allergy problems really are quite overlapping and quite common.
I wanted to tell you, the next time we get together too,
Yeah.
I would like to ask you about peanut allergy.
Yeah.
See, when we were kids, we had peanut butter and jelly sandwiches every day,
Right.
practically. Now, you have to be careful with this stuff because it can be fatal, actually.
Yeah, what happened over time is that we too civil and too modernized now, and the civility and modernization and advancement is taking you away from nature. So less exposure to basic nature is the definition of industrial and advanced society and country.
Okay.
And America certainly is the epicenter for that. And as you keep yourself away from those, your body is not doing what it's designed to do. So you don't see germs, you don't see dirt around it, or you don't go to bond and touch animal or play with them. That's what your body immune system is supposed to do.
Mm-hmm.
So now your workload is reduced, but capacity is there, so it get abused, if you will. So a lot of time, and this is exactly why allergies and for that fact autoimmune diseases are on the uptick, is because all these problems are, this body has extra capacity because they are not dealing with what they're supposed to do.
Get a
So-
call here, Doc.
Sure.
Hi, you're on the air.
Yeah, I'm just wondering about allergies to titanium and other metals. Is that something that the doctor approaches? Thank you, I'll hang up.
Okay.
Yeah, a very interesting question. Comes a couple of times a year. Titanium is a very inert and expensive metal, and that is why all the medical devices and implants are made out of that. So very rarely do we see, I can count on one hand how many true patients with titanium allergy were there, but a lot of people who get implants, sometimes they have problem healing and sometimes they have ongoing problem at the site of implant. And that is how this question comes about, that are they allergic to something which was implanted inside their body and over time it's causing. So there it can happen, but that's the reason titanium is picked up. So certainly can happen, and for any patient who's having the problem, this is 100% for that person as opposed to how uncommon this is. So it can happen, and we can do the testing, the patch testing, and many times I actually have the medical company provide me with the device and apply that to patient body to see if there's any reaction to it. So it's very rare condition, and it takes much longer to figure it out. But I have seen very few patients with it, and usually they've been able to resolve once I think patient had to undergo and they had to take the implant out. But very, very rare. And these are kind of research institute, and I get in touch with people who specialize in this up and down the coast, and I can seek advice from them at times. But patch testing can identify those.
That's an interesting question. I never
Yeah.
thought of that either. But
Well, I mean, she's right. Likely she's experiencing or have somebody who is, and that's how it came about.
sure.
So very rare, but it can happen. Metal allergy. Nickel is very common allergy. Every month or 2 months I'll see some patient with nickel allergy. I just saw somebody at Jefferson who's having a big problem, a young kid with ongoing rash. Exactly, you look at it, it was the textbook case where and he had a big, belt with a big buckle butting right against his skin. That's where the problem was.
Really?
And then you get jeans with the button in it, with nickel in it,
Yeah.
and it keeps dropping on it. So it's the metal, nickel, the cheaper metal is less pure, and cheaper metal, less pure, it causes more allergy in it.
Okay.
So more expensive is more pure, and that causes less problem. Nickel is common and used every place, and it's the main metal allergy to be had.
Geez, I never thought I did that one either. So.
Yeah.
Interesting stuff. Doc, it's always great to have you on here.
Sure.
There's a lot of other subjects we can talk about, so I'm hoping to come back.
Absolutely.